Now moving on to how to perform evaluations, examinations, or assessment in more of a sports setting. So on the field, our priority at all time is to keep everyone alive. Although it may seem like a given, it is sometimes a bit more complicated in some sports than others. So the first part is typically more covered under a first aid course, such as the Red Cross. I'll go through it briefly, but if you ever intend on being a first aider for sport, you should definitely get either a first responder course or a sports first responder course so that you actually have all the skill needed to provide emergency care during a sport emergency. So the first thing you should do is a primary survey, which is really, is there an immediate threat to this person being alive? So UABC stands for unconscious, airway, breathing, circulation. Circulation is, do they have a pulse? And also, is there a arterial bleeding? So do they have an artery that is just ejecting blood with each heartbeat? If so, if any of these things is compromised, call 911. You have a life-threatening situation on your hand, and you should activate your emergency action plan. If this is under control, then you can move on to your secondary survey. In order to do it, and there's a order of priority, which you can summarize with the letters D, E, F, and G. D stands for disability. So is there any head, spine, or pelvis injury? And are some of those probably life-threatening? Epithelial is there a moderate bleeding from, not arterial because that was part of your C, but like a venous bleeding? Like, is there internal bleeding in the abdomen or any of the other cavity, chest cavity, that may cause a life-threatening situation down the road or cause severe disability as well? And then F is for fracture. Do they have any obvious deformity? Where is the fracture located? If it's the femur, it actually goes really close to disability because you need to immobilize the pelvis and the spine in order to protect the femoral fracture. And where we actually work the most is in the G. Is general, so sprain, strain, contusion, cuts, and scrapes. That would be, 85 to 90% of our general practice. But that doesn't mean that you don't have to be ready and practice for any other scenario in the UABCDEF. Basically, what you're trying to do is, how is the patient coming out of the field? Is he exiting on a stretcher with the paramedics? Is he walking off? Do you need help from other people? If it's somebody that's much larger than you and has a lower body injury, I would suggest that you get two of their bigger teammates as well to come help you so that you don't get injured as well. So that is our first concern. Now, this course, is not focused on the first aid part so much. So let's start with F, like how do we determine whether there's a fracture? Well, first of all, can you see the bone? Is there an obvious deformity? Like, if the answer is yes to these two questions, well, then assume there's a fracture, immobilize, and send them to the emergency so that they can get an x-ray, and then they can have a scheduled appointment with an orthopedic surgeon as soon as possible to see if there's further steps that need to be taken. Can they move? Do they have any tingling or numbness? So is there possible damage to vascular or neural structures around the bone? Do they have a good circulation? Do they have normal sensation? And you can assess that using the acronym PMSC, which stands for pulse, motor, sensory, and capillary refill. The pulse, you always want to take the pulse distal to the injury to make sure that there's still a good supply of blood further down the chain. Motor, can they move their fingers? Can they move their toes? Sensory, can they feel their hand and feet? So you're gonna just gently rub your hand on their hand or their foot and compare with the other side. Is it the same sensation? Is there a normal sensation? And finally, cap refill. If you press hard enough on any of your nails, you'll see that you lose color. It becomes white, and then as you release it, the colors come back. That's the refill of the capillary under your nail. It should take 2 to 4 seconds to come back. If it takes longer than that, you might have a circulation issue. And that actually any of them is a emergency, and they should be seen at the hospital ASAP. Even if you don't think there's anything, if there's an impairment of any of those, you can suspect that there's something going on that is really abnormal. And then could they get up on their own? Can they walk on their own if it's a lower extremity? So if they can, then give them the assistance they need. And if they can't, well, you might have to find an alternative way of removing them from the field. And if you don't have the means, then that means you're calling the ambulance and you're staying on the field with them until the ambulance comes in, regardless of what the referees, coaches, parents, and everybody says around you. Now that you've decided that it can come off the field, then you bring them to your, little station on the sideline, and you can ask them more relevant questions. So you want more information on what was the mechanism of injury. So you obviously ask question on the field about that before, but you want to really know everything that happened. So what position was their foot, their knee? Did somebody tackle them? Did somebody push them? Where is the pain? How severe is the pain? And what movement increases the pain at that moment? Then you can do your observation. So you look for swelling, deformity, redness, hate, and discoloration. Those are the 5 signs of inflammation. So if there is inflammation, that means there's structural damage, which means that there's an injury that can be made worse by returning to play. Then you go through your active, passive range of motion, your resisted range of motion, your special test, and your palpation, always respecting the principle that you have to go from the least likely to hurt to the most likely to hurt. Now, if they can do all this and they have minimal pain, you'll put them to the functional test. Again, if they have swelling and a lot of pain, there's no use in doing the functional test. Just give them the care they need, whether you want to put ice on or not, regarding your instinct, your reading on the matter, or your personal belief. But don't put them to the functional test if you know already that they're not going to go back to the game. Now, if you're still on the fence, then you have to check, are they able to do their job on the field, to do it well, that they are not going to re-injure themselves, and do it well that they're not going to end up being yelled at by their coach because they're limping around, not paying attention, or whatever. So you have to put them through sport-specific skills or position-specific skills when necessary, when different positions have different components to their game. For example, in football, every position have a different job, so they all have different sport-specific skills they need to go through. So, for example, a wide receiver for lower extremity, I would put them through some little bit of jogging in a straight line, sprinting in a straight line, to sprinting with some changes in direction, to a jump and landing on 2 feet, 1 foot, and then putting everything together where they have to sprint as fast as they can, change direction, jump to catch a pass, land, and sprint again, so that I mimic every portion um, of their job on the field. And I can also ask if there's somebody that wants to follow them and put a little pressure on them, maybe push them around a bit when they're about to catch the pass, to make sure that I really stress that can they do their job without further injuring themselves. And then if I were to work with a offensive guard or a lineman, then I would get them to do some squats, uh, getting up from their starting position, pushing against a teammate, uh, like in a straight position in different direction. So that's very different from what I would do for the receivers. Now, if they can do that with minimal pain, then I have to assess in my head, can they return to play? So here are the criteria. Minimal pain and swelling. Obviously, none is preferable, but as you move up in levels and age, you'll see that, especially with some contact sport, people play with pain all the time. If you limit the access to fields, people have no pain, nobody's playing. So, minimal pain and swelling that basically do not alter their biomechanics while they're performing their sport. Full range of motion, full strength, and no fear of injury. Now, if there is a little bit of pain or a little bit of issue with, like, they're compensating, if you put a taping on them, does that fix the issue? If so, then you send them in with a taping. Now, if they still have a very bad running mechanics with the taping, then as they go on the field, they are likely to re-injure that pathology or create other pathology, so you don't return them. And one of the factors that is often overlooked is the fear of injury. You have to create an environment where your athletes are comfortable telling you when they are not comfortable to go play, regardless of the external pressures that on them from their teammates or the coaches. So, what are the objective or the labs of this semester? So, the most important one to me is getting comfortable interacting with patients. So having a clear, concise instruction in a language that's adapted to your patients. That means if you're assessing an ankle, you're not asking the patient to do eversion and inversion. You're telling them to turning their ankle out and in, uh, finding the language that they will understand. It is also a general introduction to evaluation and putting all the pieces together to get a clinical impression. But what it is not is that this course that does not give you the ability to use these skills without the supervision of a licensed healthcare professional. In order to do that, you need, in order to use range of motion and special tests and all that, you need to be a licensed healthcare. Otherwise, if you make the wrong call based on this or create more injury based on this, you are absolutely liable without having any liability insurance, which means that you could go bankrupt from doing this. If you want to work as a first aider and provide emergency care in sports, that's fine. Again, like I said, get your first responder or your sports first responder, but then you're only providing first aid. You're not doing range of motion assessment, you're not doing special tests, and you're not giving advice on how to rehab, because that is not your scope of practice as a student. In addition, the lab should give you the ability to understand what you're doing during an internship with a physiotherapist in a clinic, or if you do a work study with the athletic therapist here at the university. So just having the background information so that you can understand what's going on and ask questions to further your understanding as well.